There's an isolation that happens when you're just trying to put food on the table and you're working as hard as you can, you're doing everything you can, and yet it seems like not only are there not the supports that you need, but even if they were available, you don't have the time for it. And so I think we really need to start rethinking about how we're valuing people differently.
The most pressing mental and behavioral health issues that are affecting kids in our community, I would say, are trauma and post-traumatic stress, as well as grief and bereavement. And this has impacted our communities of color more than any other. And we're also finding that Black youth in particular are experiencing much higher rates of deaths due to homicide. So when we look carefully at why we're seeing this spike in post-traumatic stress and maladaptive grief reactions, particularly in youth of color, one of the primary reasons is because of the types of deaths that they're being exposed to on a regular basis. There have been a lot of systematic barriers to accessing behavioral health care.
The reasons that we don't have enough access to care are in part financial, that we still have too many people who are uninsured who have insurance that does not provide all of the resources necessary to really get a handle on some of these very complex problems.
So mental health challenges and problems often remain unrecognized and undiagnosed because people themselves are not recognizing it. And even when they do, there might be cultural or other barriers that prevent them from seeking treatment.
There is still too much stigma associated with it. There are people who don't either recognize that they need that kind of help or are ashamed to ask for that kind of help. And of course, when they don't get the help that they need, their lives suffer, as do their families, their friends, their employers, and it just snowballs.
Then you have other people who absolutely recognize that something's wrong, but they don't have health insurance or they don't have financial ability to be able to compensate and pay for it. But I think more and more people are having conversations about this and about ways to create a system where every person has equal opportunity to be able to have mental health and well-being.
About half of U.S. children will experience a trauma sometime during the course of their lives. And what we often see is that this is the root cause of so many mental health issues that are troubling kids today. And if that doesn't get addressed, the community suffers. Community violence, domestic violence, sex trafficking stem from unresolved and unaddressed childhood trauma and the resulting mental health consequences. So this speaks to the need to be able to identify these kids as quickly as we can and get them the treatment they need so that they can go on to lead healthy, happy lives and contribute to society.